Hello, and welcome to this course on dealing with trauma. Many people with post-traumatic stress disorder also experience other mental health challenges alongside their trauma symptoms. These co-occurring conditions, such as depression, anxiety, and substance use disorders, can complicate recovery but are treatable with the right approach. Understanding the interaction between trauma and these conditions is crucial for creating an effective treatment plan. Here's a comprehensive guide to managing some of the most common co-occurring conditions with trauma. Trauma and depression frequently occur together, as the emotional toll of trauma can lead to feelings of hopelessness, sadness, and loss of interest in activities. Depression can make it even harder to manage trauma symptoms because it drains energy and motivation, making everyday tasks feel overwhelming. How they interact. The experience of trauma can lead to a deep sense of grief, guilt, or shame, which are core feelings in depression. Trauma symptoms like avoidance and hyperarousal can also fuel feelings of isolation and worthlessness, further exacerbating depression. Signs of depression in post-traumatic stress disorder. Persistent feelings of sadness or hopelessness, loss of interest in activities once enjoyed. Fatigue, lack of energy, and trouble sleeping. Difficulty concentrating and making decisions. Treatment approaches. Cognitive behavioral therapy, CBT. CBT is highly effective for both trauma and depression. It helps people challenge negative thinking patterns that contribute to depression while also addressing trauma-related thoughts. Medication. Antidepressants, such as SSRIs, sertraline, paroxetine, are commonly prescribed for both trauma and depression to help regulate mood and reduce intrusive thoughts. Lifestyle changes. Incorporating regular exercise, maintaining a healthy sleep routine, and engaging in meaningful activities can also help lift depressive symptoms. Treating depression alongside trauma often involves a combination of therapy and medication to help restore a sense of purpose, motivation, and emotional balance. It's common for individuals with trauma to also experience anxiety disorders, such as generalized anxiety disorder, GAD, panic disorder, or social anxiety. The heightened state of arousal and constant feeling of threat associated with trauma can trigger or worsen anxiety symptoms. How they interact. Post-traumatic stress disorder involves a heightened sense of danger and hypervigilance, which can make ordinary situations feel unsafe. This constant state of alertness can spiral into anxiety disorders, where the person feels anxious even in situations unrelated to their trauma. Signs of anxiety in post-traumatic stress disorder. Constant feelings of nervousness or unease. Panic attacks. Intense feelings of fear or dread, often accompanied by physical symptoms like a racing heart. Avoidance of social situations or places where escape seems difficult, common in social anxiety. Difficulty relaxing or feeling on edge most of the time. Treatment approaches. Exposure therapy. This can help with both trauma and anxiety by gradually exposing the person to their fears, helping them learn that their triggers are not dangerous. Mindfulness and relaxation techniques. Breathing exercises and mindfulness practices can help reduce anxiety by calming the nervous system and teaching individuals how to stay present without getting caught up in fearful thoughts. Medications. SSRIs and benzodiazepines may be prescribed to help reduce anxiety symptoms, though benzodiazepines are typically used short-term due to the risk of dependency. Managing anxiety alongside trauma requires teaching the individual how to manage their physical symptoms of anxiety, like rapid heart rate or panic, while also addressing the trauma that is contributing to these feelings. People with trauma are at higher risk of developing substance use disorders, SUDs, as they may turn to drugs or alcohol to cope with overwhelming emotions or escape from trauma-related thoughts. Unfortunately, substance use often worsens trauma symptoms and creates a cycle of dependency and avoidance. How they interact. Trauma can lead to overwhelming emotions like fear, anger, or guilt, and some individuals may use substances to numb these feelings. While alcohol or drugs may provide temporary relief, they tend to make trauma symptoms worse in the long run by disrupting sleep, increasing anxiety, and impairing judgment. Signs of substance use disorder in post-traumatic stress disorder. Increased use of alcohol or drugs to cope with stress or trauma reminders. Difficulty controlling or reducing substance use. using substances to manage sleep problems or emotional distress. O. Withdrawal symptoms or needing to use more to get the same effect. Treatment approaches. O. Integrated treatment. Treating both trauma and substance use disorder at the same time is essential for success. Therapy should focus on reducing reliance on substances while addressing the trauma that drives the substance use. O. Cognitive behavioral therapy, CBT. CBT is effective in helping individuals identify triggers for substance use and learn healthier coping strategies for managing trauma and stress. Support groups. Peer support through groups like Alcoholics Anonymous, AA, or Narcotics Anonymous, NA, can provide accountability and community for those trying to reduce their substance use. O. Medications. Medications like naltrexone or buprenorphine may be prescribed to help reduce cravings for alcohol or opioids. Addressing substance use in trauma treatment is critical because untreated substance use can interfere with other therapeutic efforts and worsen trauma symptoms. Key takeaways on managing co-occurring conditions. Post-traumatic stress disorder and depression. These conditions often reinforce one another, making it crucial to treat both with therapy, medication, and lifestyle changes. Post-traumatic stress disorder and anxiety. Managing anxiety disorders alongside trauma involves therapy, relaxation techniques, and sometimes medication to address the constant state of fear. Substance use and post-traumatic stress disorder. Integrated treatment is necessary to break the cycle of using substances to cope with trauma, and therapy should focus on finding healthier coping strategies. In summary, co-occurring conditions can complicate trauma recovery, but with the right combination of therapy, medication, and support, individuals can manage both their trauma symptoms and the challenges posed by depression, anxiety, or substance use. These videos are made possible thanks to our amazing sponsors. Meet anyone for anything on the Introducer app. Whether you're looking for friends, romance, or something in between, Introducer has you covered. Download for free today. Experience a new heaven and a new earth in a virtual paradise and global community. Church has never looked like this. Your contribution can bring Earth 2.0 to life. Finally, if you'd prefer to watch these videos without ads, visit our mental wellness hub on the Happy app. Click the links in the description. Finally, although this course was free for you, it was not free to get it to you. Please consider giving a small donation to help spread these courses around the world to those most in need. The link is in the description. See you in the next lesson.